Hello, and welcome to the Love Mia Vita podcast. I'm Jerry DiPiano, CEO of FemPharma. Thank you for joining me as we discuss all things women's health and wellness. Please note that this information is simply that. It's information to help you to think through your decisions. Please consult your medical practitioner to discuss your personal situation. Thank you. Hello, Dr. Katherine Sherif. It's nice to see you
Hello,
again.
Dr. Jerry DiPiano.
So, Katherine Sherif, Dr. Katherine Sherif is a primary care physician who specializes in treating the whole woman. And for those of you that haven't met her through our YouTube, our Instagram, or our podcasts, Katherine, perhaps you can share a little bit of information with those that are tuning in for the podcast.
Sure. So I'm one of the physicians at Jefferson Women's Primary Care in Philadelphia. I'm an internist, and I think that it is our job to pay attention to women's health, to gynecologic issues, and that women shouldn't have to go to two different doctors to treat gynecologic and reproductive issues. So at Women's Health, as you said, Jerry, we treat the whole woman.
And that is so important. In today's podcast, we're going to be speaking about the issues that are facing women when they hit an important milestone. And no, it's not 30, and it's not 50. So it's women when they hit the age of 40. And I don't know if you remember it, where you're not even 40. But anyway, I am definitely past 40. And I remember when I hit 40,
Yeah.
the thing that I was worried about most was that I couldn't read small print any longer, so I had to get bifocals, and I was horrified because it was sort of that part of coming of age that I wasn't really excited about. But I managed to find some pretty cool bifocals, and as you can see, I've never stopped wearing glasses since. But all kidding aside, there are a number of questions that women have when they hit the magic age of 40, and it's not old, and it isn't even midlife, because as we take better care of ourselves, midlife is probably in the 50s, right? Because women are living much longer these days, provided that they start thinking about how they are behaving, how they are handling their diagnostics, and how they are addressing their mental health when they are 40. So this is our topic for today. And I guess what do you think when a woman hits the age of 40? What do you think she should be considering in terms of her health? What's your top of the list?
Well, yeah, I can think of four things right off the bat that seem urgent, but if I had to choose one, it would be nutrition, because the nutrition you have at 40 can affect the trajectory for the rest of your life. If you haven't eaten well for years, you can do that. You can like hit a hard reset at 40 and say, I commit to eating well. It's something we do every single day. So we get the chance. It's like you get the chance to do it right with your next meal and the next day and the next week and so on. I think that we have forgotten so much about nutrition in the face of aggressive marketing from agribusiness in this country, and that the way our grandparents or great grandparents ate it could be foreign. I also think it's like not sexy to talk about nutrition, and we don't give it the attention it deserves. And I think it's hard to say that it's more important than exercise or more important than sleep, but it is critical.
You know, it's interesting that you bring up nutrition, because we know that there are a number of women who are conditioned to believe that they should look like social X-rays, right? That's my term for women who are dying to be thin. And let's face it, whether it's, someone that you see on TV or whether it is someone that you know who's wearing a size 00, women can abuse their bodies by not eating properly or not eating, period. And that has an impact on you as you age as well. So that's starving yourself. It's really thinking carefully about what you put in your mouth every single day, including looking at products that are ultra processed, that are high in sugars. There's some conversation about changing the formulation of Coca-Cola to get rid of the high fructose sugar and to change that to add cane sugar. It's sugar.
It sure is. It
You
sure is.
know, I, we laugh about it, but these are the sorts of messages that make no sense whatsoever. So yeah, nutrition to me is something that is super important. I'm trying to recall whether that was pivotal for me when I hit 40. I think I was a little late on that one, but I'm working on it. So nutrition. Then we think about various types of testing. And these are some of the questions that we receive at FemPharma from women who are in our audience, women who are customers of ours or read our blog posts or tune into our podcast. So we often get the question, what sort of testing do I need? What's key for me now that I'm 40?
Yes, so 40 is usually associated with the time that we start to screen for breast cancer. And most professional medical organizations agree that we should start screening for breast cancer at age 40. Sometimes people will say, why don't you do it sooner, especially if young people are getting more cancers at younger ages. And the reason is that when you have a mammogram and you're x-raying the breasts, if there's fat in there and you x-ray fat, fat looks black on an x-ray. And if there's something that shouldn't be there, it's white, right? To simplify it. The younger you are, the less fat you have in your breast, the more tissue you have in there. So as we get older, we put more and more fat in our breasts and they're easier to x-ray. The younger you are, the more it looks like this jungle of white stuff on the mammogram, on the x-ray. And so it's really much harder to detect malignancies. So that's why we've sort of settled for the age of 40, where we are already replacing tissue with fat. So it's easier to x-ray. So generally we start at age 40. The old guidelines were to start at age 35. We'll often recommend screening mammograms at younger ages, say 35, if a mother or a sister, a close family member has breast cancer.
You know, we have run clinical trials looking at fibrocystic breast condition. And so when we have seen women who have had fibrocystic breast condition, we will often suggest that they do an ultrasound because they can tend to be younger women who are suffering from pain associated with that condition. And to your point, it's because the issues that you just described. It would be easier to determine whether there is a reason to include them or exclude them, I should say, from some of these clinical trials, because obviously we want to make sure that these are healthy women. And if they do have an issue, that they can be referred on.
Yes, and thank you for saying fibrocystic breast condition and not fibrocystic breast disease.
Yes, and it is. I mean, most of these women will show up with cyclical breast pain, different from non-cyclical breast pain. And that is another distinction that's important because if it's non-cyclical breast pain, it could be that you have some other condition. Maybe it's not in your breast, maybe it's your chest muscles. If you are large chested, maybe that's one of the reasons. But nonetheless, any woman that has breast pain should see a practitioner and have it evaluated.
Yeah.
So mammograms, number one. What else? What other diagnostic tests should women be thinking about?
Well, after 30, we increased the interval between pap smears to every 5 years, before 30, every 3 years. So that continues at age 40. We don't recommend screening colonoscopies until age 45. It used to be that we would recommend screening colonoscopy at age 50, and the age was dropped because of the higher incidence of colon cancer in younger people. And I'm wondering now if we should drop the age of colonoscopy even more, another 5 years. So we're waiting to hear from the guidelines organizations about whether we should do that. Another thing is sometimes people get to 40 and they haven't had their lipids measured yet, meaning cholesterol levels. And it's important to get those if you haven't already had them.
And is this irrespective of whether there's any family history? So just as a standard, doesn't matter whether you have a parent or first degree relative that has any cardiovascular disease, getting your cholesterol assessed is probably a good idea when you hit 40.
It's a very good idea.
What about testing for diabetes, even if you don't have any overt signs? That's something we should be thinking about at 40?
Yes, so there's two ways to measure sugar. One is just your sugar, your glucose, and which is usually part of a blood chemistry. And you may have had that every year or maybe not at all. The other way to measure it is the hemoglobin A1C, and that's what we call the 3-month sugar. And it's the number of red blood cells under a microscope that have a glucose molecule stuck to them. And normal is under 5.7. If you, for example, if you looked at 100 red blood cells, you would want to have the red blood cells, fewer than 6 out of those 100 would have a sugar stuck to them. The number we use is 5.7. If that 3-month sugar is over 5.7, you're pre-diabetic. And if it's over 6.5, you're diabetic. And what's interesting is that, or over 6.4, sugar is sticky. And it actually, when it's in our blood, it sticks to red blood cells. So it's a cool way to measure sugar.
So hemoglobin A1C.
Yes.
So there's another one. Boy, we're going to be spending a lot of time on that 40th birthday doing some of this really good benchmark, right? And I guess that's it. It's really, you're doing a baseline assessment of where you are at 40 to think about what happens next. And
Yeah.
hopefully the next is that things are looking pretty good. And now you can continue doing some of the good work that you are doing. But if not, then there's some additional strategies that I think you shared earlier. Figure out what you're doing with your nutrition as a starting point. Um, what about looking at things like vaccinations? I know that we often hear that there are individuals that have never had chickenpox, for example, that perhaps didn't have the HPV vaccine. What are your recommendations with respect to vaccinations when you hit 40?
Well, in when the until lung cancer became the #1 cancer killer of women in the world, and this is because we export cigarettes to other countries, the #1 cancer killer of women was cervical cancer. And cervical cancer in the US, less than 3,000 women a year die of cervical cancer because we do pap smears often. And we pick up cells before they're cancerous, when they're precancerous or pre-precancerous. And the human papillomavirus vaccine, it could get that down to 0. We could have nobody die of cervical cancer. But this didn't start until about, I guess it was 15, 20 years ago that people started getting vaccinated for HPV. and insurance only paid for it up to the age of 25 or 26. But I do believe that some insurance companies now are covering women up to age 40. And if your insurance covers the human papillomavirus, I would strongly suggest that you get vaccinated for it. It's a series of 3 over 6 months. And overseas, it would change the world because, there's only one way to spread the human papillomavirus, which is through sex. People have sex. Women get this high risk human papillomavirus, which causes cervical cancer. Cervical cancer is a tough way to die, and I've seen a lot of it.
What this is perhaps a bit of a sensitive topic, but we also hear about HPV in the throat. So because of oral sex.
Yeah.
So that may cause throat cancer or some sort of oral malignancy or what have you. So again, irrespective of what your sexual proclivities are, it probably makes sense to think about the HPV vaccine because a 40-year-old, to your point, probably didn't get vaccinated when she was 10 or 11 years old, given the time of introduction of that vaccination. Um, there are a whole cohort of individuals who are 40 that probably never had chickenpox.
Yes. Yes.
And we know that chickenpox is not a great thing to have when you hit the age of 40. And again, given the fact that we are global travelers, you may want to think about chickenpox.
Yeah. So what you could do is have your physician check your immune titers. Do you have antibodies to varicella, the name of the virus that causes chickenpox? If you do, if they're above a certain level, you're protected because there's herd protection sometimes, right? Remember, our parents put us in the bathtub with the kids who had chickenpox, so we would all get it. And so there is herd protection where you can have antibodies but not have been sick or very mildly sick. So if you're worried about your measles, mumps, and rubella, you can have titers for that as well. And also, thank you for bringing up the risk of throat cancer, or what we call oropharyngeal cancer. The human papillomavirus doesn't care if it's in the cervix and the vagina, or if it's in the anus and the rectum, or if it's in the throat. If it finds a nice place to nestle, it'll set up shop there. And so you can get abnormal cells in your throat and your rectum, just as you can on the cervix. And unfortunately, there are no guidelines as of today to screen women for throat cancer or rectal cancer. You could do a pap smear of those areas. Insurance wouldn't cover it, and that's because there are no guidelines. The only guidelines are to check for anal cancer in men who have sex with other men who have high risk behavior. So Jerry, I'm pretty worried about increasing incidence of throat and that we will see an increased incidence of throat and rectal cancer soon.
Well, just to digress just a bit, there are subpopulations of individuals that are unwilling to use birth control, whether that's, in the form of a condom or in the case of a female, whether it's oral contraceptives, things of that nature. And so they believe that by having other forms of sexual intercourse, insertive intercourse, that they will not get pregnant. And pregnancy is, yes, it is something to be concerned about, right? But these other issues could lead to an increased incidence of just what you described: anal cancers, rectal cancers, oral cancers, etc. So your sexual practices should, if you are an individual who is engaged in different types of practices, perhaps you want to think about having that HPV vaccine for that very reason.
Yeah.
And by the way, we do talk about this with women,
Mhm.
but men should be thinking about the HPV vaccine as well.
Of course they should. Yes.
Yeah. Um, so we talk about some of the testing too. And when we think about various testing that is done, if a woman has had a number of sexual partners, should she be HIV tested?
Yes. If you are requesting set testing for sexually transmitted infections, you should do them for all of them. What's nice is if we do a pap smear, we can also test you at the same time for chlamydia, gonorrhea, and trichomonas. And it's in the same little sample bottle as we get the cells from the cervix. But the syphilis and HIV need to be blood tests. And you should ask for them, even if you think your risk is really low. If you're requesting STD testing or STI testing, then you should ask for those as well. There's another common bacterium called Mycobacterium genitalium, which has been around for a while, and it wasn't treated as a sexually transmitted infection until recently, and we test for that now. But it's not widely known, but it's easy to test for, and you can test it in the urine.
So we always advocate for using protection if you are having intercourse, even if you think you're in a monogamous relationship, right? You don't know until you do the test and figure out that perhaps you weren't in a monogamous relationship. So
Yeah,
always a good idea. You've hit 40, whether you are in a committed relationship or you are still, enjoying being single. Sounds like HIV testing or STI testing is also a good idea for you to think about what's going to happen for the rest of your life.
yeah.
And obviously, there are no vaccines for HIV. There are some opportunities for us to consider with PrEP, etc., but there are no vaccines. So getting tested, knowing, and being able to communicate that with any future partners is also really important. We talk a lot about, these kinds of tests. We also need to do a check-in for mental health. How important is this, is the aspect of mental health and screenings for things like mood disorders?
I think it's important. I think it has been so ignored. I think we have very little infrastructure in this country for good mental health care. Um, it's hard to find a good therapist. It's hard to find good psychiatric care, um, and depression and anxiety are rampant. There's two websites that I'd like to mention that can help people find someone. One is psychologytoday.com. So you go on there and you put your zip code in where you'd like to see a mental health specialist, and you can filter it. So once you put your zip code in, a whole list of therapists can come up. And the therapists have a photo of themselves there. They have their philosophy, what they, do they do couples or families or divorce and so on, eating disorders, whatever their interests are. And then often they'll have the financial information at the bottom. So that can help. Another place is called openpathcollective.org, not .com, openpathcollective.org. And this is a place where therapists who donate their time for lower fees, like they may have a practice with higher fees, but they do take clients with lower fees there. And that's another place. But the thing is, you still have to meet with the person and decide that it's a good fit.
Yeah. Building that relationship and that, excuse me, that trust has to be fundamental because you're revisiting perhaps things from your past, things that are very intimate.
Yeah.
And, so building the right relationship with your therapist, we've discussed this previously with one of our medical advisory board members, Dr. Juliana Hauser. It is fundamental, and you try it and see if it works, and if not, then you can always move on. It's kind of, I guess it's sort of like dating, right?
Yeah.
You have to feel comfortable with the reality of sharing all this intimate information about yourself and so forth. Um, when we think about mental health, 40 seems not to be, a magical number, but it is for women because women may start to experience changes hormonally due to pre and perimenopausal symptoms. So hormonal shifts are also known to become more prominent when women enter their 40s. And women may enter perimenopause in their 40s. So checking in with yourself is probably pretty important when you hit 40. But what other things should women take into consideration relative to some of these hormonal shifts?
Well, the way menopause has been defined doesn't make any sense. Right? So the actual definition is 1 year since your last period. We've talked about this. So let's say that's age 50. So what happens between 35 and 50 or 40 and 50 when you really start to see changes or see changes in your body and your brain due to the decrease in your hormones? So starting around age 35 average, your estrogen and progesterone starts to go down. And estrogen is trickling down, progesterone goes down a little faster. And so it's not unusual to hear women who are 40 having trouble sleeping, having changes in their menstrual periods. And they'll say, well, it used to be 5 days of bright red blood, but now it's 3 days of very heavy bright red blood, and then 2 days of old brown schmutz. And I don't understand what something's wrong with me. And it's just the change in your hormones. And then it's not just that the hormones are going down, down, down like this, you also get spikes. So if out of nowhere you have breast tenderness and it's not just before your period, that may be your ovary trying to spike and just push and make more estrogen, and then you can feel it. So I would say that perimenopausal changes uh, often become apparent at 40, sometimes in the years before, and that we need to understand that perimenopause is a process. When you were an adolescent, you didn't become a little girl and then become a woman overnight. You had adolescence, that miserable period, and it's a transition, and it's a way longer transition on the way out.
Yes. And it's unfortunate that for years we never talked about perimenopause, or, we heard about the change. It's like, okay, what am I? Am I a butterfly? I'm going to grow wings, or I'm going to, shrivel up. What is it? What is this? And our mothers rarely discussed it. They oftentimes, at least I know my mom would say the change, and the change never bothered her. So she lucky mom. But when we think about perimenopause today, you're right. There's more information that has come into the fold, and that information really needs to be vetted. So what we always say is do your research, because we are a research-based company. And when I say do your research, listening to podcasts like this one, where you have board certified healthcare practitioners that really understand the biochemistry and the physiology of perimenopause and menopause and postmenopause is really important. Read, do your reading. Come prepared with a checklist for your healthcare practitioner. You might end up surprising yourself because the answers that you receive may still be inadequate. That may mean you need to find another healthcare practitioner because let's face it, and we've talked about this before, medical schools didn't do a great job of teaching physicians what they need to know about women because everything was based on the default male. So it's perhaps not your healthcare practitioner's fault, but there are practitioners like Dr. Sherif who did take the time and invested the resources to learn more about women as unique with their anatomy and physiology and the way that drugs were metabolized in the body and the way that bodies metabolize drugs.
Yes. You know, and when we talk about hormones, I think 40 is a good time to reflect on um, our how we see ourselves and as sexual beings, how we think about our attractiveness. You know, we're raised to be sex objects. We are raised to think of ourselves as sex objects. And like a good example of that is being told to wear nice underwear, because what if you were in an accident and your skirt was up and people would see your underpants? Like that's an object. That's teaching you to be an object. And so, you know, the society objectifies us, we internalize that, and we worry so much about our attractiveness. And then when you're 40, some of the bloom may have come off, and um, you women can feel really bad about themselves, about not being as firm, about not feeling as attractive as they used to, and we have got to make peace with that.
I That's really great advice. And it goes back to something that I was reading about a week or so ago, which is a movement for women not to show up on a first date with makeup. So it's to go with the natural look. So come as you are, because it's really about getting to know the person. So what's up here, what's in your heart, whether show up with ethics and integrity, um, you know, who are you? And it's more than just, the eyelashes and the lipstick. It's more than what we put on our faces, and what we put on our bodies. It's really what's behind the scenes, and that's really coming from the soul. And I thought it was fabulous. And I would love to take a page out of that. I'm not sure I'd probably scare people if I showed up on this podcast without my makeup, but I might have to try that with my husband and see if he recognizes me.
Yeah, it's something we struggle with. And you know, when I do meet women in my practice who have not been thoughtful about how we age and what they've internalized, um, they don't seem to like themselves very much. They're hard on themselves. It's hard to watch, women disliking their bodies and disliking themselves because they're not the same cute thing that they were at 25. You know, it robs you of your dignity and happiness and worrying about how attractive you are. And the older you get, the younger people get. And so the self-esteem thing is something I worry about, even for today's young women.
Yeah,
I don't think it's as bad as it used to be.
it's I believe that this next generation has, been more thoughtful than perhaps we were in terms of the way that we approached what we perceive as beauty. We're still fighting the objectification of women. And again, the dying to be thin is also something that we are still struggling with as women. It's,
Yeah.
different bodies, different cultures recognize body shapes, for what they are. Just they're beautiful as they are. And that's something that we need to work on. Perhaps that's something that we need to work on with a mental health professional as well.
Yes.
So these are great tips for women who've hit the age of 40, but I think in general they are great tips for women of pretty much any age. Definitely as we start to approach 40 and you happen to be a woman who is older than 40 and you haven't had some of these diagnostic tests or you haven't paid attention to your nutrition, this is really great advice. It's never too late. If you think that you've missed something along the way, it's not too late to check it out, make sure that you have the right assessment done, and get going. Live the rest of your life for the best of your life.
I agree. Yeah, and I would like women to get to 40 and not feel like it's the beginning of the end. I'd like them to see it as a new beginning. I'd like them to think about, how am I going to plan the next 40 years? How do I want them to go?
Absolutely. Great advice, Catherine. So, as always, it's a pleasure to have you as my co host on the Love Mia Vita podcast. Dr. Catherine Sherif, I will see you next time. And until then, remember to love Mia Vita. And I will close by saying to all of you listening in, be sure to take your health seriously and follow some of Dr. Catherine Sharif's advice.
Take care.
Take care. Thank you for joining us on the Love Mia Vita podcast. Love Mia Vita means love my life, and that is a mantra we should all live by. Please like and subscribe wherever you get your podcasts, and check out our website at fempharma.com. Remember to live well and love Mia Vita.